Good morning. Dr. Patino here at the Cosmetic Surgical Center for Toledo. We're going to do power-assisted microwave power assist. Look at this. See, I turn the cannula and it starts vibrating, right? So I don't have to do the job, right? It's like an electric toothbrush, right? I just put it in there and I don't have to be jamming the instrument back and forth. I just put it gently there and you're going to be the first one to see what comes out of here. I promise you it's going to be yellow, beautiful fat, right? And we're going to see it in a little bit, right? What comes out. This is pretty incredible. I can already see a little yellow there, you see? This is pretty incredible, but you see my motions are very, very slow. And we got very low power. It's not like this is going at full power. See, and what color is that? Can you see what's coming out?
Yeah, yellow.
Catherine, can you take a... So Catherine is our anesthesia provider today, and this is only your second time here with us, is that right?
Yeah, that's right.
And first we did a tummy tuck, and what did you notice on that tummy tuck?
There was very little blood loss.
Exactly. And what do you see? Have you seen liposuction done by other surgeons?
Not that often, but...
Not that much? The ones that you've seen, what comes out? Is it like this or no?
More blood than that.
Huh?
More blood than that.
More blood than that. Do you see any blood loss here?
No.
There's
It's yellow.
no blood loss. Pretty incredible.
Yeah.
And you know what? Now there's a bill that wants to pass in Florida that is limiting the amount of blood loss. Wow. So what do you see? What do you see there, Catherine?
Pure fat.
Incredible, right?
Yeah.
Yeah, this is very, very beautiful, the way we do these in a very controlled manner. But also, have you noticed that my strokes here? Come take a look at me.
So yellow, it looks like gold.
Wow, so look at that, huh?
Wow.
Wow is what? What do you see?
She looks amazing. Look at that definition.
You mean this thing here?
Oh yeah, that slope.
That's the waist, because she's on her side, right?
Yeah, you can
And
see
then-
down those slopes.
And the incredible, beautiful aspirate, right? Yellow fat, that's what's gonna go into her buttocks, this yellow, beautiful fat that we're getting here, right?
Yes.
And we're toward the end already of this case, right? On one side. We're gonna turn to the other side, but we're basically toward the end. And notice the complete absence of bleeding and the beautiful aspirate that we're getting here. But notice how my movements are much slower. I compare these to like the speed of a bullet. If you get the bullet in one hand and put it against your other hand, nothing's gonna happen, right? But if you put the bullet in a pistol at full speed, then you're gonna cause some damage. And this is the same thing. Yeah, so yeah, at the end of the day, you know, we save time because we don't have to like process the fat. We have never centrifuged fat or nothing like that, because when the aspirate is all red and what's gonna go on the buttocks is all red, you know, surgeons spend, you know, sometimes up to an hour or more, you know, processing that fat, right? And even then, after the fat is processed, it's not gonna be like this. Thank you. Okay, so this is part of the surgery. This is called the pinch test. Do you see any fat in here, you guys?
No.
Look at this. Do you see any fat?
No
Look
fat.
at this. This is basically, look at that. See? Everywhere I go, look at this. See? It's called the pinch test. See? No fat here. See?
Yeah.
Everywhere.
Just
Incredible.
skin.
See? Everywhere I go, it's beautiful. See? Very,
Perfect.
very fat-free. Thank you. So notice the speed, okay? Very, very gentle speed here, right? And
Yeah.
notice what's coming out. Follow all that yellow, beautiful fat. This is what's gonna go into her buttocks. And guess what? You know what? 30 or 50% of the fat growth that people put in is lost. But you know why it's lost? A lot of it is because what you're putting is not your fat. You're putting fat mixed with blood, and it looks red when it goes into the buttocks. Thank you. Show that other side how it was. Now it's looking better already after the liposuction here, but we want to get this really, because this is her waist,
Yes.
and we want to get it like on the other side. Really go down,
Defined.
right? Really
Nice
defined.
definition.
Yeah, thank you. Wow, we don't get tired of this river of fat, yellow, beautiful fat. Thank you. Okay, so still getting yellow fat here. And this is actually the fat that's going to go into her buttocks. So when we put the the fat in the buttocks, you're gonna notice how it's yellow and beautiful, and of course you're gonna retain a lot of, if not all of that fat, because it's your fat. Thank you. Okay, so we're gonna do ultrasound guided gluteal fat transfer. What color is that fat that's going into her buttocks?
Yellow.
Yellow, beautiful fat, man. That's the ticket right here at the Cosmetic Surgery Center of Costa Rica. We want to do this in a controlled manner and put the fat where God put it, which is between the skin and the muscle, not into the muscle, and definitely not under the muscle, because that could be dangerous, right? So that's what we're doing, and we're teaching doctors. We have 15 centers in the United States teaching doctors how to do this procedure safely with the World Association of Gluteal Surgeons. Thank you. Okay, very good. So same thing here. We're doing ultrasound guided gluteal fat transfer here at the Cosmetic Surgical Center of El Cervino. And we're putting the fat where the fat belongs. The fat belongs between the skin and the muscle, not into the muscle. If you put the fat into the muscle, that's dangerous, and the patient can die. We never had anybody die, and we want to keep it this way, so we do this under ultrasound guidance, and we're teaching doctors from all over the world how to do this in a safe manner. But notice, are you following this river of yellow fat, you guys?
Yes.
This is incredible, huh?
Gorgeous.
Yeah, very beautiful. How much?
100.
Thank you. So
Hey everybody, so we're transferring fat to the buttocks in the safest way possible. This is Dr. Patino's cannula right here.
I'm going to wiggle it for you, see?
Oh, wiggle, wiggle. It's right underneath the superficial gluteal fascia. And then this is the patient's skin. Right here, this is the deep gluteal fascia, and you can actually even see some striated muscle right here, and you can see that that's where the muscle is, and that's where you don't want to put any fat, because that's what would be dangerous. So we're well above that area in the safe subcutaneous space.
let me pull out the cannula a bit, and you kind of follow that cannula.
So we're going to follow the cannula as it comes out. There we go. So
You
there's the tip.
you see the tip? Now focus to where the tip is.
Let's see, can we pull out just a little bit?
Yeah.
There we go.
And so now look at the tip right there. Okay, I'm gonna give it a bolus. You're gonna see,
Basically what that means is fat is going to enter this space right here.
you see
Which
that
means-
cloud of yellow?
Right here. Alright, so to review, this is the tip of the cannula, this is doctor's instrument, this is the tip, and there's already a little cloud where Dr. Patino is putting in fat, and you can see it kind of moving right there, which is pretty cool. The deep gluteal fascia, you can see, actually got pushed down a little bit because fat entered this space, and then the superficial gluteal fascia got pushed up a little bit, which is what we're going to see is fat
Now
comes here.
point to the tip now, and watch the gray cloud is gonna come there. You see?
Yeah,
Oh yeah.
so everything's getting pushed right here.
You see?
And see the superficial gluteal fascia keeps getting pushed up, deep gluteal fascia keeps getting pushed down.
Thank you.
Deep gluteal fascia right here, you can see the beautiful striated muscle this way. And Dr. Patino's cannula is this really bright, straight line.
I'm gonna
right here.
wiggle it so you can see it.
Wiggle, wiggle. And we have the superficial gluteal fascia right here and the skin all the way up there. So you can see we're right, like, pretty much in the middle of the subcutaneous space.
It's not a big space, right?
Not really,
Okay.
yeah. A lot of patients, you know, are kind of closer to here or sometimes even lower.
You
So
can
yeah, it's
easily-
just kind of a tinier space, huh?
You could easily miss it, right?
Right,
If you go in the wrong place, that could be a problem. So that's why we do it under ultrasound.
for sure.
Thank you.
Alright, so here's the tip of Doctor's cannula. He's going to give us a bolus, which means the fat's going to enter this space. And you can already see that the deep gluteal fascia is being pushed down, the superficial is being pushed out, the cannula is moving back this way, and this whole area is being filled with a cloud of fat.
I'm gonna go back in there, you see?
More.
There you go.
Wow, that's awesome.
Very beautiful. Thank you.
Alright, so we have a deeper view. You can see now we're looking at 5 centimeters in depth, and that's allowing us to see where the deep gluteal fascia was pushed. So it's now, we may have started, it was here, and now it's being pushed all the way down here. And we're right in the middle of the subcutaneous space, which is defined by here and there.
Between the superficial gluteal fascia, the deep gluteal fascia is where we want to be.
Right.
That's also cutaneous space, even above, below the skin right there. Yeah.
Yeah.
Above the superficial gluteal fascia and below the skin. But my cannula is in between the superficial gluteal fascia, show it to them, and the deep gluteal fascia, and show them the striations of the muscle.
Right here.
That's what we don't
what's
want to
really
go.
cool. Yeah, don't go in there.
Show them the gray area. What is that?
That's all fat. that we
That's
put
so
into
funny.
the buttocks.
I'm gonna give you another photo so you can see. Right there at the tip of the
That's more
cannula.
fat coming in.
Let me give you another.
Alright, so cannula right here. Doctor's putting fat into this space. You're gonna see a cloud. See that cloud is pushing there, pushing here. I'm gonna move my hand so you can see it.
Oh, that's good. Thank you. Wow, so we're done. Thank you very much. Thanks to God, today's Friday.
Yoo-hoo!